Assalamualaikum to Dr. Farhan and fellow friends. We are from Group 3 going to present about laboratory findings of clinical pathology of adrenal glands. This is the group members. Now let's get started. I will talk about locations and anatomy of adrenal glands. The adrenal glands of the mammals are located near the cranial pole of the kidney. They consist of two distinct parts, the outer cortex and the inner medulla. The paired adrenal glands are located in the retroperitoneal space, closely associated with the aorta and vena cava in the cranial abdomen. The adrenal glands have rich blood supply and experience one of the highest rates of blood flow in the body. They are served by several artery branchings of the aorta, including the suprarenal and renal artery. Blood flow to each adrenal gland at the adrenal cortex and then trends into the adrenal medulla. Adrenal hormones are released in left and right suprarenal veins. As for the anatomical structures, the cortex is yellowish in color. It secretes derived hormones, corticosteroids, and androgen. Functionally, the cortex can be divided into three regions, superficial to deep. Zona glomerulosa produces and secretes mineral corticoids such as aldosterone. Zona fasciculata produces and secretes corticosteroids such as cortisol. It also secretes a small amount of androgens. Reticularis produce and secretes androgens such as dihydropianogesterone (DHES). It also secretes small amounts of corticosteroids. The medulla lies in the centers of the glands and it is dark brown in color. It contains chromaffin cells which secrete catecholamines such as adrenalines into the bloodstream in response to stress. This hormone produces a flight or fight response. Chromaffin cells also secrete enkephalins which functions in pain control.
Hi, I'm Solehan and I will be continuing this video while talking about the adrenal gland physiology. So, as we have learned before, the adrenal gland have two major layers, which are the adrenal cortex and also the adrenal medulla. For the adrenal cortex, it produces three main types of hormones, which are the mineralocorticoids, glucocorticoids, and also adrenal androgens. So the mineralocorticoids, an example, the aldosterone, the main function is to regulate the salt and water level in the blood, which in turn, regulates the blood pressure. Then we will go on to the glucocorticoids. An example will be cortisol. So for this hormone, as the name suggests, it is mainly function as glucose production. It stimulates glucose production by consuming material from any storage such as fat and also muscle. While the third hormone produced by the adrenal cortex would be the adrenal androgens such as DHEA and testosterone. They don't have weak effects. However, they also play a role in precocious puberty, which is a development of sex organs. Now, for the adrenal medulla, they mainly produce catecholamines, which, long story short, helps in your flight and fight response, or fight and flight response. So, let's just talk about the regulation of hormones. So, when the animal is experiencing stress, the hypothalamus would secrete CRH, which is corticotropin releasing hormone, which acts on the anterior pituitary gland. This will then secrete ACTH, the corticotropic hormone, which then triggers the adrenal gland to secrete more of its hormones, which are the mineralocorticoids, glucocorticoids, and also the androgens and sex hormones. However, the ACTH mainly affects the fascicular zone, stimulating the increased production of cortisol. On the other hand, the presence of angiotensin 2 and also hypokalemia can also lead to a stimulation of production of mineralocorticoids. At the same time, stress can also affect the adrenal medulla, which causes an increase in the production of epinephrine and also norepinephrine. So, cortisol, which is in the aid of the transcortin, would then stimulate the adrenal medulla to also secrete more epinephrine and also norepinephrine. The increased spike in the concentration of epinephrine would then cause a positive feedback on the anterior pituitary gland, which results in the more secretion of the ACTH, which would then, going on a continuous loop, would then increase the amount of hormones secreted by the adrenal gland, in particular cortisol. So, with the increase in cortisol level, this will trigger a negative feedback on both the hypothalamus and the anterior pituitary gland in order to inhibit and stop and reduce the production of the CRH and also ACTH, which will in turn reduce the production of the hormones by the adrenal gland, which then returns the concentration of hormones back to normal levels as soon as the animal does not experience any stress. So that's all for me. We shall continue with the next presenter. Thank you for listening.
Hi, my name is Muhammad Alif bin Bakri. My metric number D17A0016. When we talk about the adrenal gland disorder in animal, there are two conditions or disease involved, which are hyperadrenocorticism, also known as Cushing disease, and hypoadrenocorticism, also known as Addison disease. I will focus on hyperadrenocorticism. Hyperadrenocorticism, literally translated, hyper means overactive, adreno means adrenal gland, and corticism refer to cortex, which is the outer part of the adrenal gland. Hyperadrenocorticism or Cushing disease is the condition in which the adrenal gland overproduce certain hormone. There are two types of adrenocorticism, which are iatrogenic hyperadrenocorticism and natural occurring hyperadrenocorticism. Iatrogenic hyperadrenocorticism refers to the disease when it is induced by long-term administration of high dose of cortisol-like drug. For example, corticosteroid. This drug often used to manage inflammation and allergy in animal. Next, natural occurring hyperadrenocorticism. It refers to excess production of cortisol by adrenal gland due to adrenal gland tumor or pituitary gland tumor. Condition of excess production of cortisol due to adrenal gland tumor called as adrenal dependent disease, while if it occur due to pituitary gland tumor, it called as pituitary dependent disease. Adrenal dependent disease more commonly occur compared to pituitary dependent disease. In pituitary dependent disease, pituitary gland will overproduce adrenocorticotropic hormone ACTH, which stimulate the adrenal gland to produce more cortisol, leading to excess cortisol in body. Hyperadrenocorticism commonly occur in dog compared to cat. Common affected age in dog is middle age to older, between 7 to 12 years old, while in cat it affects older cat, which more than 10 years old. The common clinical sign in the adrenocorticism is polydipsia, polyuria, increased appetite, enlargement of abdomen, lethargic, muscle wasting and weakness, poor coat condition, hair loss, curling of the ear tips, thin and fragile skin.
Hi, Assalamualaikum warahmatullahi taala wabarakatuh. My name is Wan Ahmad Syafiq bin Wan Salman, matrix number D17A0039, and my fellow friend.
Hi, my name is Aida binti Muhammad Hashim, and my metric number is D15A0002.
So today we're gonna present hypoadrenocorticism, also known as Cushing disease, test procedure. So there is a common screening test that can be performed in veterinary hospital or clinic using blood or urine samples. There are several tests such as CBC, Serum Biochemistry test, urinalysis, and urine cortisol creatinine ratio. So Aida will present about CBC.
Hi. So for the first that I want to talk is about the complete blood count test, which the red blood cell, white blood cell, and platelet components in the blood sample are evaluated. Often an increase in the number of white blood cell, which is neutrophil and monocytes, is noted with Cushing's disease. This increase is usually related directly to the effects of excessive cortisol, but occasionally an increase in these cells may indicate underlying inflammation or infection.
Okay. For the second test, which is a serum biochemistry test, the serum contains the enzymes, protein, lipid, glucose, and metabolites. These serum components are derived from different organs such as liver, kidney, and pancreas. So this serum can give us indication of function of this organ. The specific changes in the serum biochemistry profile can support the diagnosis of Cushing disease and may give us indication of overall organ function. The typical findings with Cushing disease may include increase in blood glucose or hyperglycemia. A certain liver enzyme like alkaline phosphatase ALP will increase directly in response to increased blood cortisol level. Increase in blood lipid and cholesterol also can be found in Cushing disease. Okay, the next is urinalysis. Because the dogs with Cushing disease typically drink large amount of water, the urine produced become very diluted. So we use a special instrument called refractometer to assess the urine concentration. Infection of bladder, also known as cystitis, is a common finding in Cushing disease. By looking at the cells voided into the urine and by sending a urine sample for bacterial culture to check the bacterial growth, the presence of infection can be assessed. Some dogs with Cushing disease also have concurrent diabetes. The presence of diabetes can be detected by the presence of glucose in the urine, as well as there is increase of concentration of glucose in the serum biochemistry profile.
So next, I will talk about urine cortisol creatinine ratio test. So the amount of cortisol being lost in the urine is increased with Cushing's disease. This cortisol can be measured and compared to the amount of creatinine, a normally occurring urinary component that is produced at a constant rate. The urine cortisol creatinine ratio is usually elevated with Cushing's disease. However, stress and other illness may also increase this ratio. While an increased urine cortisol creatinine ratio is suggestive of Cushing's disease, it cannot absolutely confirm the diagnosis as well.
I think that's all. Thank you.
Thank you.
Assalamualaikum. Now I will present about the hypoadrenocorticism or Addison's disease. It is a deficiency in adrenocortical hormones. For canine hypoadrenocorticism, it is divided into primary, atypical, secondary, and also tertiary. While feline hypoadrenocorticism, which is rarely to occur, is divided into primary and secondary. For primary hypoadrenocorticism, it results from immune-mediated destruction of all three adrenal cortical layers, which results in inadequate secretion of both mineralocorticoids and glucocorticoids. And also for secondary hypoadrenocorticism, it is due to failure of the pituitary gland to secrete adrenocorticotropic hormone, resulting in severe atrophy of the zona fasciculata and also zona reticularis with an intact zona glomerulosa. So for tertiary hypoadrenocorticism, it is due to hypothalamic disorders that causes disruption to corticotropin releasing hormone. So for commonly affected age, for primary hypoadrenocorticism is in young to middle-aged female dogs, and for atypical hypoadrenocorticism is in older ages. For feline hypoadrenocorticism, the age ranges from 1.5 to 14 years of age. The clinical signs is often unnoticed due to the vague clinical signs that can be confused with other metabolic diseases. And other clinical signs that can be seen are hypotension, emesis, diarrhea, which is common in canine and rare in feline, waxing and wane cause of illness, weakness, myocardia, dehydration and hemoconcentration, anorexia, and also weight loss. That's all from me. Thank you.
Assalamualaikum. My name is Nufatia Kamal. Today I will show the result for the patient that have hypoadrenocorticism in dog. So from the complete blood count in hemogram, the patient will have anemia and polycythemia. The anemia can be happen due to low in packet cell volume because of the animal will lose all the fluid via excretion into the urine. While for the polycythemia, it happen due to the animal is dehydrated that cause this red blood cell concentration to be increased. Then we move on to the leukogram. In the leukogram, the patient will have lymphocytosis and eosinophilia. This happen due to cortisol level is low. So this lack of the cortisol level will reduce lysis of the lymphocyte and eosinophil. So because of that, the number of the cell will be increased. Then we move on to the serum biochemistry. Okay, the patient that suffer from hypoadrenocorticism will have azotemia. This azotemia happen due to lack of water reabsorption in the kidney. Then the patient also will have hypocalcemia and hypoalbuminemia. This hypoalbuminemia can be happen due to all the plasma albumin was lost via the excretion into the urine. Then the patient also will have hypoglycemia. This hypoglycemia happen due to lack of cortisol to maintain the blood glucose level into in the bloodstream. So next we move on to the urinalysis. So the patient that have hypoadrenocorticism will have a low in urine specific gravity. This is because the urine will be diluted because the water cannot be reabsorbed back into the body. So all the water will be excreted out as a urine. So because of that, the urine will be diluted. Lastly, we can do ACTH stimulation test. This ACTH stimulation test is used to measure how the adrenal gland respond to the adrenocorticotropic hormone. So if the patient suffer from the primary hypoadrenocorticism, the ACTH concentration will be increased. This is because the primary hypoadrenocorticism is happen due to there is problem directly on the adrenal gland itself. So if ACTH level is increased, that means that there is no damage or injury or problem at the pituitary gland. While for the secondary hypoadrenocorticism, the ACTH concentration will be low because this secondary hypoadrenocorticism is happen if there is an injury or problem on the pituitary gland that cause the ACTH to be reduced. So for the hypoadrenocorticism in the cat, I will pass to Alia Inshira.
Hello, I'm Alia. I'm going to explain about hypoadrenocorticism in feline. We can see that from the table beside that the patient is considered to have anemia, or specifically non-regenerative anemia. Anemia occurs because of the low impact cell volume, so anemia undergo fluid loss by the excretion. However, it is considered as a non-regenerative anemia because of the low reticulocyte, which indicate the body unable to respond to a demand of red blood cells. Then we move to the serum biochemistry. Same like what happened in the dog that has been explained by Fatin before, a cat might suffer azotemia because of the poor water reabsorption. They also suffer from hypocalcemia, which indicates kidney disease, and hypoalbuminemia that correspond to the hypercalcemia. The patient also has hypoglycemia regarding the lack of cortisol in the blood glucose level in the blood circulation. Then, we can expect that the patient might undergo hyponatremia and hypochloremia that caused due to the loss during diarrhea and vomiting as it stated in the clinical sign in the slide before. And last, the patient is likely to have a hypophosphatemia. This is because the elevation of phosphorus usually can be seen in kidney disease. Then we move to the urinalysis. So specific gravity is determined by the ability of the kidney to concentrate urine in response to the hydration status. For this case, the patient is expected to have a very low USG or urine specific gravity, which is 1.040, which indicate low water reabsorption. Thank you.
Okay, hi everyone. I will talk about a less commonly used test to assess the adrenal gland function. So this test is what we call as the TON test. So the principle of this test is to measure the level of eosinophil upon the response of exogenous ACTH. When we compare with other more commonly used tests, we usually measure the level of cortisol. But for this test, we measure the level of eosinophil. So when we talk about the test to assess the adrenal gland function, first of all, we have to know the normal physiology and normal mechanism on how it works. So in a normal situation, when there is a release of ACTH from the pituitary gland, it will stimulate the adrenal gland to release the cortisol hormone. And then one of the function of cortisol hormone is to depress the circulating eosinophils. So in healthy animal, when we give the exogenous ACTH, the adrenal gland, which is healthy, can actually produce a cortisol, which will then lead to decrease in blood eosinophil. But then in the animal that have adrenal gland insufficiency or adrenal gland hypoplasia or adrenal gland atrophy, then despite of the exogenous or endogenous ACTH, the adrenal gland cannot respond. So the adrenal gland cannot produce cortisol, and then we can't see any decrease of blood eosinophil. So this is how the test actually perform. So for the procedure, it's very simple, same as other ACTH simulation tests, just that we take the blood before we inject the ACTH, and then we inject the synthetic ACTH, and then after 2 hours, we collect the blood to see whether there is a depression of circulating eosinophil or not. If there is no decrease, that means the patient adrenal gland cannot produce cortisol in response of exogenous ACTH. So this is a less commonly used test nowadays, because now with the technology and everything, it's very easy for us to actually to read the level of cortisol in the blood. But back in 50 years or 60 years ago, when there is no this kind of facility, people tends to use this TON test to actually assess the adrenal gland function. So this is just one of us sharing purpose. So just for you guys to know that actually there's an alternative way to assess the response of cortisol, not only the level of cortisol. So that's all from me. Thank you.